But I'm Innovation VP at Ximedica, and I would agree with many of the speakers today that it is a really exciting time to be a medical product designer. And our specialty as an FDA-registered company at Ximedica is developing regulated medical devices for our clients. And our work covers the gamut from physical products to digital products, and it's leading edge, working with labs like MIT and Stanford for spin-outs, and of course for all the way up to Fortune 20 companies from Denmark to Cincinnati. And some of you may also know me as the founder of Bridge Design in San Francisco, recently acquired by Ximedica, and we're now a proud member of the Ximedica family. Now, obviously, our job used to be about designing individual medical products, but now, of course, it's become all about designing for the ecosystem. And this slide shows just a few of the products we've worked on that are around ecosystem-based products. For Gecko, we designed this real-time monitoring device and adherence device for people with asthma, and this company was recently acquired by Teva. And for Helios, we designed this brain neurostimulation device to help with brain plasticity for people recovering from brain injury and brain trauma. And of course, we've worked on numerous products for various kinds of chronic diseases, including, of course, diabetes. Let's take a glance into the near future for a hypothetical ecosystem based on a fictional but archetypical healthcare consumer like Sue. And Sue has been living with type 1 diabetes for 30 years. She's a busy mum, and her health plan has recently referred her to a local health practice that is taking on the business of trying to more closely monitor her diabetes. And this health practice has just added this service. And they want to move Sue from the very unconnected world of fingerstick blood tests and multiple daily injections of insulin to an artificial pancreas system which uses a smartphone app to link an insulin pump and a continuous glucose monitor. And because it's a first-generation product, it still requires some input from Sue, for instance, her food intake. Now, Sue is prepared to give this a try, but she's a bit skeptical. She's worried about giving up control of some of the things she's used to being in control of her own diabetes. And for the first time, she has an app on her smartphone that must run 24/7, and it's now life support. And she's also got to wear stuff on her body, and she's worried that this might advertise her diabetes to the world, especially in the summer when she's wearing light clothing. Now, her diabetes doctor has just taken on this new method of managing patients. And he's worried that and it's the first time he's worked on something where he's got real-time data in the cloud being compiled on his patients. Now, he's worried that the decision support software that's being used doesn't make him miss anything that he might need to take more urgent action on. And of course, it's also true that he's now compensated partly by how much he helps save the health plan, not just on fee-for-service, and this requires a new way to looking at how he runs his business. And of course, the health plan has now combining historic big data with real-time data about Sue to actually impact the way Sue is treated today. And of course, researchers working on the artificial pancreas want the aggregated data to figure out how to improve the algorithms. So as we explore an ecosystem such as this, it gets pretty complicated pretty quickly. But Sue, of course, doesn't want to make a project out of her disease. She wants it to fit seamlessly into her life and, of course, be no bother and distraction. So how do we do this? My colleagues and I at Ximedica have identified 4 critical areas that we think are important in this field of engagement and adherence in this new medical complex ecosystem world. First, understand the broad context of the disease and the stakeholders, and probe it to where you can add value. Now, obviously, your company, an individual company, can't realistically cover all the bases on a disease ecosystem, whether you're an entrepreneur at a startup or a Fortune 100 company. So you really need to work on understanding the people part. That, of course, is the patients, the providers, the payers, etc. You also need to understand the medical condition in its broadest context. Not just a joint if you're an orthopedics company, not just a test result if you're a monitoring company, and not just a cardiometabolic drug if you're a pharma. So for instance, if you're a joint company, you might be considering building out an ecosystem that perhaps has a series of apps, both for physical therapists and for patients. There might be a special wearable for your calf that monitors much more carefully specific therapy and adherence. And it's all, of course, all in the service of making the treatment, the overall treatment, more cost effective and the outcome better and the recovery time and so on for the patient better. Secondly, we've got to cut through the hype of engagement and adherence and use the evidence-based research that's out there. Ask, will my users use it, not simply can they use it? Research into human nature indicates that we're going to be most successful where we meet users where they are, not where we might want them to be. We've got to move on from the finger-wagging of yesterday's healthcare and instead move round to the same side as the boulder as our patients and figure out what motivates them, what's going to make them change, and help them push the boulder in a much better general direction. And of course, it's not just the patients that have got adherence issues, as other speakers have mentioned. It's, of course, the doctors, nurses, the caregivers, and so on, who are going to need just as much cajoling to help the person they're trying to help as the patient themselves. But the good news is that the evidence-based sciences of behavioral psychology and behavioral economics have a lot to offer to help us. They suggest things like really understanding the obstacles to making a choice and then working on ways to reducing those obstacles. You need to look at rewards and think about what's really going to work and when they're going to work. And a hint here is it's not about the way we usually think about gamification in the more general sense. We've also got to understand what the value people place on familiarity. So, for instance, Sue might have a much easier time adopting this artificial pancreas product if the look and feel of the interface has perhaps a slightly retro feel to the way she's used to managing her diabetes and not just focusing on the new and cool aspects of it. She's going to feel much more comfortable about adopting this. And the third point is choose your technology and design to be an absolute slave to making your product get used and be useful, not just focusing on what's cool and new about it. For instance, Sue, excuse me, not just what's cool and new about it. Bear with me a second. Sometimes it's what you leave out that matters, not just what you're putting in. So, for instance, Sue might really, your team may be focused on putting new features into the product that offer new opportunities, but Sue might want you to reduce the display to a minimal display, halve the drug volume in the reservoir, and make it much easier for her to wear underneath her party dress. So, my slides are out of order, sorry. So anyway, the third thing is, in terms of wearables, we've got to think well beyond the band. As an industry, of course, we've been doing wearables for a number of years, think pacemakers and Fitbits and so on. And this is Sue with her party dress on, sorry about this. And for other ecosystem products, you might have to cannibalize your own products or disrupt them. And you've got to think about expanding your team's skill sets, which may have come of age in a very different world. And you've got to think out which pieces of the jigsaw puzzle am I missing, and how can I work to put these into my team and integrate them into my activities. And obviously, here we are at CES, we've got to learn as an industry to plunder the latest advances in software and hardware from this unregulated world and move it into the regulated world as quickly as possible. My last point is the understanding the FDA and the general regulatory system, not only how it affects your products, but also how it affects the way you develop them. The FDA is, of course, your partner and also a stakeholder. So, for instance, this may be something that's interesting for those of you coming from the tech and consumer worlds, not used to our regulated world. You may be wanting your product to be unregulated, but of course the meaty technical, meaty healthcare issues that you're going to try and solve are going to require class 2 and above type of regulation. And to conclude here, let me push the Darwinian metaphor. While digital healthcare is going to allow exciting new medical ecosystems, let's not forget the forces of natural selection. This new competitive landscape is going to really speed up change by brutally culling products. So to avoid becoming an inadvertent dinosaur, you'll need to move quickly and wisely into this new environment of complex medical ecosystems. Thank you very much for listening.